All right, I think we're ready to roll.
So we should be ready to go here. We are recording this, so anybody who is not available to hear the entire presentation, you will have a recording available to you on the website after this meeting. So let me get started. I am Patty Gebert. Welcome to the third and final pre-AIM webinar. These webinars, a series of webinars, is designed to really give you an idea of what the AIM conference has and how to leverage that experience. So I'm going to start out with a short introduction of the conference today, and then I'm going to hand it over to Dr. Scott Walter of DHA to run a panel discussion on mechanisms for collaboration, technology transfer, and commercialization with the military. Okay. So here is a fast agenda. We will have, after my introduction, a talk with, or a presentation by Mr. Bob Charles, who is online today. And then we'll have a technology transfer panel with Dr. Scott Walter, Mr. Jim Weissman, Ms. Sharon Knabel, Ms. Diana Neves, who is online, and Dr. Alicia Swan, and then Lieutenant Colonel Christopher Moon. So we'll be doing another introduction with them as we get ready for the panel. So without further ado, let's talk a little bit about the AIM conference. So if you haven't heard or registered for the AIM conference, it is taking place June 24th and 25th at the Henry B. Gonzalez Convention Center right here in beautiful San Antonio. It is a full 2-day conference where we will, for the first time, be bringing 3 events together in this 2 days. So the 2 major events that we're bringing together are the Military Medical Industry Day. So this is going to be the 5th year of the Military Medical Industry Day, and the SURF Conference, which is the San Antonio Military Health and University Research Forum. This is the 10th year of this forum. So we have 2 very established events that are coming together in order to give you an idea of bench to battlefield transition, development and transition of military medical capabilities. So it's packed full of information on the research side. SURF typically has over 300 attendees. There'll be at least 70 poster presentations, research poster presentations from academia as well as military researchers. And then there are 12 one-hour podium presentations, which represent 36 individual podium presentations from investigators. So most of that programming is happening on June 24th. On June 24th and 25th, we have programming from the Military Medical Industry Day, which is really, well, we'll talk more about that. It focuses on the military's capability gaps and how to leverage those gaps for commercialization if you're a company, as well as clarifying the process of working with the military in order to help commercialize your products. So how to leverage this 2-day conference. You want to go in prepared because there's a lot of information that you can take advantage of. I mentioned the podium presentations for the researchers. The military researchers provide a very unique view of what the military capabilities or what the military is looking for as far as the development of military medical capabilities. And so this is one way to understand what they're researching and what their research priorities are. There are also going to be a number of panels on the vision for DoD medical product development with the DoD medical stakeholders as well, or leadership, as well as the DHA portfolio managers. And then we also offer lots of opportunities to meet people and network. We get to talk to researchers and end users from the Army, Air Force, Navy, VAMC, and Veterans Affairs with 10-minute one-on-one pitch sessions. So there's a 3-hour afternoon time slot for these one-on-one sessions. You can pre-register for the 10-minute session. So anybody who is registered for the conference will be sent pre-registration information for these time slots. We'll also be sending out information as to how to best leverage that time. You can pitch your products to the military stakeholders and just talk to them about the development of your technology. So here is an idea of what those podium sessions look like. We have 12 total podium session running topic areas from precision medicine to trauma and emergency medicine research. We have a lot of research capability here in Texas, here in San Antonio. And so this kind of gives you an idea of what those service units are researching here and what type, this will give you an idea of the type of research that they're doing. So very broad and diverse. For the one-on-one sessions, we have identified which sessions are going to be available on which day. So on both days, the sessions run from 1 until 4. And so here is a list of the sessions that will be running on the first day as well as the second day. And this slide deck is also going to be available online, so you don't have to take any pictures or, okay, so learn how to collaborate when you come to AIM. Learn how to collaborate with researchers for product development, how to sell to the DHA as well as the VA, and learn how to find end users for your product, because the end users are really the ones that are going to be important in adopting the use of your product, but it's very important also to go through the military researchers because they're going to validate and verify your technology. So having access to these individuals to build collaborative relationships is very important. We also have sessions on research, product development, how to fund that research through grants and contracts, congressional special interest, consortium OTAs like MTech, SBIR, STTR, and well as angel investors and venture capitals. So venture capitalists. So lots of great information. It's also a great opportunity to see innovative dual use technology as well as plenty of opportunities for networking. So we look forward to seeing you at AIM. If you have not registered, you can go to aimsatx.com and register there. Or you can go to the Velocity Texas website, velocitytx.org, and register there. Okay, so past meetings, we have those pre-recordings for the past pre-meeting webinars. So not only do we have the first and second pre-meeting webinars from this year, we also have previous years also available. So you can take a look at those and really prepare yourself for the meeting. I also want to let you know that at Velocity Texas, we're building this collaborative relationship with our military research partners. And so we have office hours available. Currently, USAISR has office hours on Friday from 11 to 1. So you can contact me if you're not a resident here at Velocity Texas. You can contact me about participating in those office hours. And very soon, the 59th Medical Wing will have formal office hours that we will be posting. We're looking forward to adding others such as NAMRU in the near future. Okay, so with that, I'm going to hand the mic over to Dr. Scott Walter.
Thank you, Patty. Thank you all for being here today and being online. And obviously what we're trying to do here is to prepare you so that you get the most you can out of the AIM conference. The 2 days that you'll invest your time and effort, we wanted you to have the maximum results of that. And what we have here today assembled is, of course, I have to reveal the other part, and that's we're here to whet your appetite because we really want you to be there because we'll benefit by your presence and your knowledge that you bring. But what we have here today is a brain trust of tech transfer from the various services that have been working here in San Antonio for years and have just a tremendous amount of knowledge that they can and support that they can provide. And by introducing them today, they'll be here, I'll be at the Henry B. Gonzalez Center next month. So if you don't able to get your answer today, or you come back with a question or want to work with them, want to work with that service, with that area, they'll be there. So you'll say, hey, I know that person, and you can approach them and engage directly. So heads up team, there's a cost that comes with this, with volunteering here to be here today. But with that being said, tech transfer is more powerful for the community that we work with, industry, academia, nonprofit, but it's also so important, such a powerful tool for the military and military organizations to use because it allows us to work and do almost anything except transfer money. We can share almost any resource, share knowledge, work together, come up with a better solution, because we know in the military, we need y'all's input, we need your ideas, and sometimes your money, and then we can better invest our money and our funding to obtain the medical assets, sources, capabilities that we're looking for. So with that introduction, we'd like to turn over to Bob. Bob Charles is he's an icon. I'm not sure anything would adequately represent what he's accomplished and provided to the military for several dozen years. But I almost want to say he doesn't need an introduction, but I would be very honored to introduce him. He's our medical legal representation and has made a tremendous difference for the Air Force the past couple of years as we transitioned from Air Force to DHA. So I'm indebted to him, and if I were to have any more children, I would have to name him Bob. So with that being said, Bob's got a little video overview about what tech transfer agreements are, a couple of videos for you to watch. And after we're completed with that, we'll go around the panel and each person will be able to talk about their area and their program and give you more insight to that. So, can I miss anything?
No, so,
Okay.
is Bob on?
Bob, are you online?
Okay. Can you hear me?
We can hear you.
That's wonderful. Again, thank you very much to Velocity Texas, Patty, and Dr. Scott Walter from the Science. I'm honored to be here, and I'm sorry I'm not down there. I will be down there for the AIM conference. I'm on grandfathering duty in Orlando, Florida. At the moment, fortunately, my wife has the children right now, and so I'll be able to address you. Today, I'm going to just talk about how you participants from industry can collaborate with DoD facilities and why you should do that. If we could go to the second slide, please. That's my disclaimer. My children and grandchildren also don't accept anything I say at face value. All right, let's go to the third one, and we're going to start off with a little video that just tells all of you about federal tech transfer writ large. So let's go ahead and play that.
Okay.
GPS navigation is everywhere these days. Our cars, our phones, and even our watches. But did you know that GPS was originally developed by our nation's top defense laboratories for use in military operations? Thanks to a process called technology transfer, GPS has been made accessible for businesses for the last 20 years. Every day, our federal laboratories conduct exciting research, create new materials and devices, invent technologies that lead to life-saving medicines, and produce the latest and greatest in science and technology. Savvy entrepreneurs and business people, like you, have benefited from federal resources by commercializing these technologies, which helped grow their business and our economy. The federal laboratories are eager to make their ideas and inventions, even their facilities, available to all American businesses, from startups to large corporations. Imagine being able to license and sell the latest technologies from NASA, the Department of Energy, or the National Institutes of Health, or gain access to state-of-the-art federal labs for your own projects. For example, you can access Brookhaven National Laboratory to conduct testing on everything from hydrogen storage materials to metallurgical reactions. You could even partner with government scientists already conducting advanced work in your field as a launching point for your totally new concepts. Some of the most groundbreaking technologies have come out of lab partnerships and lead to more spin-offs than a technology may have originally been developed for. Memory foam, originally developed by NASA to absorb shock impact during space shuttle launches, has been commercialized into products ranging from mattresses to sports equipment and even prosthetics. A program instituted by the Department of Defense to help military commanders manage information overload has now become part of the Apple iOS we all know as Siri.
Okay, I set up your meeting for today at 4 p.m.
Start by reaching out to a federal laboratory or agency representative to see what resources they may have available. And this is where we, the Federal Laboratory Consortium for Technology Transfer, the FLC, come in. Visit our website at www.federallabs.org to find out how technology transfer can help your business succeed and ensure our continued competitiveness in the global economy.
Great, thank you so much. I play that for a couple of reasons. One is both to interest those who write federal tech transfers that it exists, and to let you know that the federal labs, including our hospitals, have been involved in federal tech transfer since the 1980s. So there is nothing new here. I'm a retired Army lawyer, and I did my first collaborative agreement back in 1994 when I was stationed at Brooke Army Medical.
We've also done a bunch of policies together today.
Okay,
What
so I
have you
walked
got
away.
We may have an open mic if you wouldn't
I got
mind.
it.
An open mic?
We're good.
Okay. Got it?
Got it.
We got it. Okay. So again, we're still on slide 3 and asking the question, well, why collaborate with a Department of Defense lab? Well, there's a number of reasons, some of which have been mentioned earlier. We have world-renowned expertise in a number of areas, including medical research, in all kinds of fields, from infectious disease to trauma, and much of it represented there by the people who will be addressing you later today at those wonderful San Antonio facilities. Our labs have world-class capabilities, so if you're a small or medium-sized company and you're looking for particular help on developing your nascent ideas, the labs have the capabilities and the expertise to help you move that technology forward. You'd have access to relevant existing data in the particular fields, and as was mentioned earlier, you can understand what DoD is really after, because we have experienced soldiers who've been out to the field who understand the needs of DoD. So you're not taking a shot at the dark. If you want to extend the type of technology that you're working, maybe for a more commercial product, towards the military market, there are people from DoD who could tell you how you would harden or otherwise prepare your technology so it would be available for the DoD market. And I know this from great experience, if you are collaborating with a DoD partner and you're applying for funds from DoD, that gives you a leg up, because it tells the people who are reviewing the applications for funding that you've got a partner within the lab who already knows that your proposed idea fits within the mission space of that laboratory. So it does give you a leg up on awards. Let's go to the next slide, please. Okay, non-disclosure agreements. It's easy enough if you've got early stage technology, but you're concerned about sharing it. First off, for anybody that you're dealing with at that federal lab that's a government employee, the federal law makes it a crime for them to divulge any of your trade secret or proprietary commercial information. We do have contractors working at our labs, but all of them are also under NDAs, non-disclosure agreements, not to share that information. So you do not need to worry. If you are, despite my great assurances that they will hold tight with your trade secret and proprietary information, if you need an NDA, we're able to get the hospital commander to sign one. It doesn't take long. We have lots of experience doing that. Next slide, please. If you are applying for DoD funding, this is the way to go. First, respond to the AIM conference or through the medical literature or through other meetings there in San Antonio or internationally, reach out. You can go ahead and reach out to the DoD scientists, and you can have early discussions and determine first, is there an interest to collaborate? Second, you can determine how you would both collaborate together. You do a proposed statement of work. This is what your company would do. This is what your university would do, and also what, in a collaboration, what the government would do. It's important that you work with the laboratory scientists to figure out what the lab's budget is going to be, because the budget is also going to need to be reimbursed. If it's doing a funding award, the government will take care of that. And you need to obtain a letter of support from the lab director for your proposed collaboration. So it's not very difficult. Let's go on to the next one, please. Okay. The next question is, do you need a separate agreement with the military facility if DoD is going to fund you? Well, that depends. It depends on the kind of award that you might get. If the award is what's called a cooperative agreement, which is kind of like a grant, then you probably won't need a separate agreement. However, if it's through a contract or what we call a prototype action agreement, or if you're not going to use a funding agreement, you just want to collaborate with the government laboratory, you can do that through a separate agreement called a cooperative research and development agreement. Now, for those of you who are not experienced in this area, I appreciate that this is a lot of information, but we'll get you through this. Just the question is, do you need a separate agreement if the government is going to fund you? Well, the answer is maybe. It depends on what kind. And if you do need a separate agreement, we can help you take care of that. Let's go on to the next slide, please. Okay. I'm going to spend a little bit of time talking about a special kind of agreement that federal labs, like those represented in our presentation today by our laboratories today, it's called a Cooperative Research and Development Agreement, otherwise known as a CRADA. And what's really nice about it is, unlike any funding award, CRADAs don't require competition. And what can be more wonderful than that? You just find out if the lab has an interest in collaborating, and if so, you do as I indicated before. You work out a statement of work with the lab researcher. You figure out what the government's costs are going to be, and that's the job of the lab researcher. And then with the help of the lab researcher, you get together a letter of support from the hospital director. Under CRADAs, it allows our laboratory to receive and provide resources. So we can offer up our personnel, our services, our equipment, facilities. We can get use or access to existing government IP, and you guys are going to negotiate who gives that and what you will give as a non-federal entity. The laboratory can receive either from your organization or from the government program office that would be funding you. As was stated earlier, the laboratory itself, like Brooke Army Medical Center or NAMRU or the 59th, that laboratory is not allowed to give you funds, but that doesn't mean the DoD itself on the higher level can't give you funds. Just means that the laboratory can't. And the CRADA will detail the data rights and IP rights. And one of the great things about it is, under the law, you as the collaborator will have an option for an exclusive license to any government invention or co-invention. So that's a great deal on one of the incentives that is in the federal law to help you and incentivize you to work with our laboratory. Let's go ahead and go to the next slide 8. So all these resources to be provided by either the laboratory or you, including how much resources, or excuse me, reimbursement go to the lab, those are all negotiable. So that's what your time will be spent negotiating who has what resources, who can give what resources, how important this is to the lab, etc. We're going to watch another short video, and though it's not about medicine, it explains a little bit about how creatives can come about and how come they're such an important tool for government and for private industry. Patty, if we could go ahead and
Flying
show-
in was a great shock. What I saw out the window of the airplane were matchsticks scattered across the hills and valleys.
The hardest part, don't have water, is cleaning and preparing the meals. That's the harder part.
There was a time that we are desperate because there's no water.
We drove up the hill and the gentleman began to shout in Spanish, pure water. The people poured out of the town and gathered some 50, 70, 100 people behind our truck. It was the only safe water they'd had.
Like a small mini water treatment plant.
It's really great. I'm impressed with the system. It's simple and very useful.
The CRADA began to help us at WaterStep define and hone better what we wanted to accomplish.
The CRADA is a Cooperative Research and Development Agreement, and that allows the federal government, EPA, to work directly with private companies. And so there's intellectual property on both sides. We can take each other's ideas and we can develop something new. I felt like we could work with them, add technology, add capabilities, and then we would have something that could be taken to the field.
This is what we need. We need water in the communities.
What EPA has done is let us say that this is the right tool in your toolkit and your family can be safe and worry about other things to get you through this crisis.
That's a really interesting video, and it tells you about a little company. Uh-oh.
Okay, I didn't get out. Sorry.
Upstaged by a rock band.
We thought it was you.
Yeah, you thought it was me. But that video was really interesting. It's about a small company, WaterStep, that had the vision that there needed to be a way to purify water in areas where, because of a natural disaster or perhaps even a man-made disaster, there was no pure water available. And so they needed, because like in the same way that our medical devices and therapeutics need to go through the FDA, any drinking water in the United States, including Puerto Rico, has to go through the EPA and get their approval. So they worked with the EPA, and as they say, they defined and refined their technology by working with the EPA and came up with a technology so that it was ready and on the ground in Puerto Rico when the disaster hit, and they could send in a team to go set it up. I think it's just a really great example of how CRADA can help the small company get a technology ready. And let me tell you that as I said, this is nothing new. We've been doing this since the mid-1980s. I have done well over 6,000 CRADAs as a lawyer for the Department of Defense. And so with our Navy friends and Air Force friends and Army friends, we've done thousands and thousands of these collaborations. I want you to know that it's nothing new. We're very experienced at getting them up, and we'd love to listen to you, see if we have some mutual interest, and then move forward. Let's go to the final slide, please. And this may be the most important thing for you out in the audience, is to understand that the end game for the Department of Defense is to help you and your company successfully commercialize a technology of importance to DoD, because we don't manufacture our own technologies. We don't market them. We can assist, we can help de-risk technologies, but we survive and we are successful when you are successful in getting technologies through to the marketplace so that DoD can buy those technologies and take them to help the warfighter. And it's the way that we can all succeed together. Again, I look forward to seeing you all in San Antonio next month. And I wish you well, and I give it back to our panel to help answer your questions. Thank you all so very much.
Thanks, Bob. That was amazing. Thank you. Great overview of information. Of course, there's a lot of also resources available online, but we'll turn over to the panel. But if you have a question and you're online, please post it in the chat and we'll get to it in the question and answer period. And if you're in the room, hold off, let the panel introduce themselves and then raise your hand and we'll call on you and you can direct your question to the panel member. What I'd like to do is, before I forget, make sure I turn it over to NAMRU San Antonio, Dr. Deanne Reeves, and make sure you're online. Are you able to introduce yourself and discuss your area over at NAMRU San Antonio?
Hello, can you hear me?
Now you can. Great. It's all yours.
Hi, I am Diana Nieves, and I am the NAMRU San Antonio Support Agreement Coordinator. So we deal a lot with the CRADAs, MOUs, MOAs, NDAs, anything related to science. That's our forte for research at NAMRU San Antonio.
That's great. And now I'll turn over the mic to Mr. Jim Wiseman.
I am Jim Weissman, and I work at the 59th Medical Wing and support agreements like Mr. Charles was speaking about to support the warfighter. And if I could say anything to just amplify what Bob was saying is that, you know, you looking at that water system, you know, why would the government or why would the DoD be interested in that? And of course, we're in austere environments all the time where we're worried about fresh water. We have folks that need medical quality stuff that they can use and execute with. And so, you know, here's something that a small company took and developed for the DoD, particularly for the military, but now you see in a disaster, it is just a life-saving thing. So the first and foremost, what is the interest that the federal government and especially the medical community has in whatever you're trying to get out there? And just always put that kind of right in the forefront of your thoughts when you're trying to approach a researcher or anybody to get the Air Force or DoD to take what your product is and develop it and help you develop it, because we're as interested as you are if it's supporting our medical teams and what they do to execute what we do in the military, which is defend the country in all kinds of environments and all kinds of situations. And there's all kinds of things that go along with that really are important. But again, with the 59th, and look forward to talking to you guys and assisting.
I'm Sharon Conable. I'm at Work Army Medical Center, Department of Clinical Investigation, the two guys back here in my office. I'm a grants manager and technology transfer specialist. As that, I do all the agreements that come through to collaborate with you on anything from pharmaceutical companies to devices. We have over 8,000 people working at VANSI, being all the different military, the Army, the Navy, the Air Force contractors. And I'd love to do more business with you. We currently have about 200 active agreements, about $25 million in funds coming to us. So please, let's work together.
Hi, I'm Alicia Swan. I'm with the Department of Veterans Affairs here in South Texas. I'm the Director for Rehabilitation Research, and I support agreements at our R&D service, or Research and Development Service, here in South Texas, CRADAs, MTAs, DUAs, and those sort of things. We don't have a local dedicated office like all these cool places, but we still want to party and do science.
Hello, my name is Lieutenant Colonel Christopher Moon. I'm here at the ISR, the Institute of Surgical Research. As of last week, we are now under DHA, but prior to that, Army, and we are one of several labs, medical labs within the U.S. Army inventory that conducts research. The Institute of Surgical Research specializes in optimizing combat casualty care. So within our footprint inside our facility, we specialize in burn, providing burn care state of the art. The only burn center within the DoD is resident right next to VAMC. So additionally, we do probably within the last 3 to 5 years, a little bit more besides physiological basis of trauma, but more along on the lines of coding and algorithms, machine learning, artificial intelligence. So that is becoming a big effort on our end, and it's growing literally year by year. My office oversees the translational research aspect, really starting from innovation all the way down to fielding, back to the warfighter. And so it takes both sides in terms of the clinical aspect of our medical care, as well as the basic sciences and applying that to our warfighters. So happy to answer any questions.
So now we'll open up to the room for any questions. If you have any, just raise your hand. We'll call in. Yes, sir. Go ahead.
Colonel Moon, sir. Will my bird team be accessible for any research for critical air transport for trauma?
I try.
So could you repeat that question again?
I wanted to use, so if we have let's say an airway device for critical air transport for the flight bird team, will we have the flight bird team as an end user evaluation platform? Would that be accessible for a company?
Yeah, so historically in the past, once the idea and then the innovation and the product subsequently is agreeable to all parties, that is definitely one of the avenues where we could go ahead and test the device. But there are other modalities as well, besides the burn flight care team within the Army inventory that we have access to.
Okay. Thank you.
Any other questions in the room? John, do we have any questions online?
We don't have any questions online. Do you want me to go to
the chat?
To the pre-questions that you sent out?
I can ask those from up here.
Okay. Yeah, we have none on the chat right now. So.
Okay. As we're going through some of our generalized questions, if you do come up with a question, please post in the chat if you're online and raise your hand and we'll get to you. My first question for the team and whoever wants to take the lead is, how do you get started? I'm a company, and I mean, obviously, you know, that's kind of lead into that question, but maybe I'm an individual researcher and I want to work with so-and-so. What would you suggest to an individual just wanting to get started?
We'll just pass it down. I mean, really the most important thing is to identify someone in the DoD that's interested in what you're doing. PI, I mean, that's really the first and foremost what you need is an advocate in whatever aspect of whatever you're doing that's in the DoD, that's familiar with the research, that's familiar with what's going on, that you can get with And then that starts the ball rolling, because if that person that's a researcher in the military is interested in your product and what you're doing, that is the long pole in the tent, is take that and then make the agreement and do all the various aspects of that cooperative research and development agreement, where you bring your expertise, we bring our expertise, and then you go from there. Any comments or questions on that? Go ahead.
So I'm just giving you feedback from a customer standpoint. So they get a researcher involved, but then they have a hard time finding an end user. That's kind of where I come in.
Right.
What the industry wants to see is more collaboration between the end user, a researcher, and the industry partner. So it seems to get stuck where someone has an idea, a researcher likes it, but it can't get to an end user. So is there a way to, I guess, what is as the DHA is taking over this umbrella, are they working more with industry? What are their plans to help us help them?
I think I'll pass this back to Scott, because Scott is an expert in this field.
Well, actually, because that's been a topic I've been discussing with Patty, we know that we need some external partners to work with. Right now, like AFRL has something called Tech Connect, and it's a place to put ideas out and then find researchers, but the researchers sometimes have contacts with the end users. So yeah, we know that's a problem, we're trying to address it, but we know that we'll need help doing it. Because each technology is unique, and so then therefore each end user is unique. I mean, if you already know that it's related to burn and patient transport, you kind of have a focal point, but if you have some clinical applications, that's a little bit harder because there's so many medical treatment facilities and finding these right people. Something that Bob alluded to earlier on the talk a few minutes ago is to go to some of these symposiums, go to some of these efforts and seek these people out. And if you can identify from a paper that presenting or a poster that, again, that gets you back to the research, but sometimes you'll also connect with the end user. So that's not a good answer right now. And I'm going to ask the team if anybody has anything you want to add. We all got a lot of experience we can share.
Yeah, so it really goes back to what the requirements are, right? As what is the end user, what is your product? If you're looking for a combat-oriented, green suit or purple suitor type of experience, there are, I would say, plenty of venues to go ahead and experiment. And that's different from training. So the military does training all the time. Go out to the field, we do virtually. Experimentation really deals with prototype development, and then the lessons learned to go ahead and start with mass production and upscaling. So those different types of venues are all throughout the year, and different types of venues, whether it's more predominantly artificial intelligence, coding, networking type of venue, as opposed to more combat casualty care. And so what I would have to say for the group is, identify the type of user that you are wanting to test or experiment your device with, and then after that, find the appropriate venue. Because the needs from clinical medicine for us within our footprint, DMC is right around the corner. Right. We have Center for the Intrepid, and that deals a lot with post-injury rehabilitation. And then, of course, within the military environment, there's a lot of different venues as well.
One more.
I would just like to add another thing that's tough on the military market, especially with the military in particular, is you're a small company, and really, what is the value proposition? If it's something that's a niche market and you're looking for someone to go ahead and license it and take it to the next level, what's the payoff? And there's a lot of things out there that are useful, and the military may want, but is it marketable to a much larger audience, and what's it going to cost? And is that company willing to say, hey, I'm putting money towards this to develop whatever that product is and take it to the government or take it to whoever. And unfortunately, with medical products, you have a worldwide market if it's something that's really needed. If it's, if it's a niche market to a very specific thing, let's take a stent, for example. How many stents are surgeons putting in any given day where someone's losing an arm worldwide? It's usually based on a war. So some companies are gonna say, how am I gonna invest a lot of money in this effort if I'm not gonna be able to sell it, except if there's a war going on or some major tragedy where there's a lot of amputees and a lot of different things happening. So you see what I'm saying there as far as having something that's marketable and usable depending on the situation in small markets.
A couple quick ideas, but one to follow on with Jim is if you're working with an end user and they're giving you the military requirements, be absolutely careful you don't build a very unique military application or device or product, because we know that we need to have commercial sales to bring that cost down, because we still have to operate within a healthcare environment, even in a deployed setting. That if we have something that could save a life, but it costs $10,000, we can only buy 2 of them, and then we may not have that capability there on site. So we really never ever want you to develop a very military unique medical product, because we know it about 95% overlap. And a couple of references with Colonel Moon, the CDID is the capabilities development, integration director. Thank you. They're here in San Antonio, and they have a couple of great online ability to submit technologies. Now, hopefully y'all are getting the monthly medical innovation research support funding. The report that Patty puts out once a month that has funding availability. In it, there is a section on how to submit technologies for CDID. So we got that included, as well as another great Army asset. It's a new product idea. Now they'll give you feedback on alignment, and that's up at Fort Detrick. They'll give you feedback on alignment to the military mission operations, but that can also then turn you in the right direction on which customers to approach. So we know we're working on it. This year with the sessions that we're having, the SME encounter sessions, we wanted to add a 5th chair. We're adding a 4th chair for the VA for some of these medical technologies, so that you can talk to the panel, mostly researchers, but we really, if we can't do it this year, next year we're going to have a medical end user representative for each of those areas. So we're not there yet. We're getting it, we're combining it. But so next year we'll definitely have a seat, and that could be somebody from SOCOM, it could be whichever organization steps forward and says, yeah, we'll represent that for our community. But that's something we're working on. Diane, I'm sorry, we didn't mean to exclude you. Do you have anything you want to add? Voice from beyond. NAMRU? Because you're in the mix too. That was a great question. So just know that it's a weakness that we're trying to address.
So appreciate what you're saying. I just came from SOMA last week. So
exactly,
you saying, I think that's what the industry wants to see, is more opportunities to collaborate. So this Velocity Texas has been a big help, as I've told you, ma'am. But for the 59th, another great opportunity for us has been working with the T-Rex site. So having those SMEs there, like you said, it's grabbing the audience and putting the product in front of us, get the real true feedback. Is this a viable product or is it not? Is it waste your time? Like you said, if it's too expensive or doesn't fit a gap initiative, then the industry is looking for more of that type of collaboration. So they're not creating a product that doesn't actually answer a gap solution. So I appreciate you guys speaking on that.
And this highlights another area that we need to address, and that's the word CRADA. The D in CRADA stands for development. And we tend to forget that or focus on the research. Development, to me, is much harder. And so, but the CRADA gives that flexibility too, to co-develop something. So to help and support that. And Bob addressed that a few minutes ago when we were talking about that it can be used to leverage other funding. Even though the CRADA cannot fund something, working with a partner gives more credibility to your proposal and your strategy and how to field this capability. So again, another great question. So it all feeds together. Any questions online?
We do have one question from Troy Tesmer. He says, as an outside private company, what is the best way to make an initial entry into a DoD to locate or collaborate with a PI if getting a PI is the key?
So I actually get a lot of phone calls and emails from people asking if they've got a product, they've got a device, they've got a drug they want to test out, can you help me find somebody? And I don't mind going to the departments within BANSI and hunting somebody down for you. I also check with the IRB office of who's doing this type of research, can you give me some names, and I'll shoot them to you. I'll be more than happy to help, and I'm sure everybody up here is the same. Also, again, like Bob had mentioned, look through your literature and look to see who's doing something like that too, and track them down. But at BANSI, I'm more than happy to help you, so please reach out.
Also the same for NAMRU.
Go to the
So, I'm sorry.
Go ahead, Diane.
Yeah.
Oh, no, I was just restating what was said, that we also the same, as, you know, for NAMRU, I'm more than willing to help, and, you know, an outsider other than DoD, to try to connect you with a PI within, for any Navy research as well.
That's great. Any other questions online? Oh, we have a question in the room, please.
So in the process, trying to small company, trying to make your case, trying to show why something is potentially needed now. When we look at the near peer adversaries that are continuing to build, we read about, is access to data. So, for example, could you assist a small company and say, I want to know how many nights we wouldn't fly in evac in Eastern Afghanistan because of conditions were red, conditions were black, or how many soldiers bled out in Iraq because we could not get them from point of injury back to some level of care. Is there any, is that all shrouded? Is it, CUI? I know it's CUI, but is it secret, or is there anybody that would help? It's not an I got you, right? It's the past, but it certainly benefits your position moving forward as to why this is
exactly what CRADA can do for you, but
okay.
I want to turn over to the team with CRADA's information. Like at that sharing agreement, you share that information.
Right, and to your question particularly, I mean, the tough part about that is, we had a golden hour or days in the last situation, but moving forward, it may be the golden month. I mean,
yeah,
so
absolutely.
all those things are kind of unknowns. Right. Moving forward with near peer competitors, and so that's the hard part. But I mean, there's smart people that have looked at that and said, hey, it's gonna, these are gonna be the scenarios, and this is what may be tough, and this is what we might need based on that. But yeah, the data is, again, getting the right people at the right time. It's asking the right questions to the right people. And that's kind of what this exists for, so that small businesses out there, the folks that have answers or may have answers, can get it to the right people to look at.
Absolutely. Sometimes though, when you submit like through AAL or AFWorks, and they're before the grace of God go I, because I went to summer school twice as an undergrad, but the judges that are looking at that submission aren't, I'm not saying they're not smart. They're not going to drill down and be able to say, I can go back in 20 years and tell you, yeah, that's exactly why. You don't get that, right? That's, the ticket to go around and collect 200. And that's a challenge I think a lot of small companies have, even in the American Seed Fund, where, they're gracious for 5%. That's a lot of money. But it's still getting that one step. And it kind of leads me to, if I may, a second question, and to the Colonel's comments before. Everybody would love to get out to certain parts of the country where you can show, it's like a rifle range, but we'll keep it safe. And you can demonstrate what you've got, and then you meet somebody to your right or left, and you start collaborating, and it starts to build. But what about simulations? Certainly in the medical realm, where we can take some of these in the D. Is that exist, or are they building that AI type system where you can say inject your device, ounces make pounds, but you got X density? Or is that somewhere where the medical community is going to move to, or is already moving in simulating this new equipment?
You hit the nail right on the head. Because within the last 3 years, I would say there's very much a large momentum to pursue and encourage what we call the T domain, the training environment. If you're familiar with the terminology .LPF, that's how the Army looks at kind of the resourcing requirements, as well as all of the different areas within a particular focus to ensure that all aspects of that particular focus is addressed. So in terms of, you were mentioning AI and simulations and training, well, big Army outside of medical is very much engaged in this area, right? You got the simulations for the new platforms for rotary, as well as with the tanks. And so the issue right now is how do we translate that into medical, and how do we go ahead and put, for example, haptics and virtual world environment for our medical care providers, whether it be the medics, whether it be the surgeons, and then how do we tie that into virtual health and telemedicine? So all of that is being incorporated right now, specifically looking at Army health systems. This is in separation from our healthcare delivery system, and so BAMC and our bigger medical treatment facilities are in the space of healthcare delivery. But how do we go ahead and place that so that we don't, so when I trained up for war to go, my last deployment into Afghanistan was we had to get a certain amount of hours back inside a field training hospital and train on trauma care. And when, we spent 2 weeks doing that. So how about, now can we shorten that time frame with realistic haptics, virtual training, and ensure that our providers and medics go out to the next deployment, train a little bit faster, a little bit quicker, and as realistically as possible. So you're absolutely right there. There are many, many different venues right now in support of that particular line of effort.
I appreciate it.
So we have a 4-minute warning.
Campaign.
Just to add on a couple quick things. Here in San Antonio, there's an organization that they manage the Joint Trauma Registry, and that has the information that you're asking about. Now, probably the best way to access is through the TPOC, the technical point of contact, or PI that you're working with, because they can work back through the system. And we're just we have so many different functions that sometimes even our own providers don't know that there's a Joint Trauma Registry that's been collecting and generating these numbers for years. I mean, since Desert Storm, Desert Shield kicked off. So we have the numbers, we maintain them because we know, we're recognizing every day how important it is to look back at what injury patterns we've seen, to know what resources we need to spend and where to improve our operations. There's also a virtual reality center here in San Antonio, and I just learned about it last week. So we gotta get that information out too. It's a virtual reality center, and that's great. It's under Defense Health Agency, so
Where is
we're
that?
growing. I don't know.
It's outside of BAMC. It's on BAMC campuses.
It's on
There's the
BAMC.
answer. So yeah, we're smarter together as a collective. I think we're getting the question, John.
Yes, Troy Tesmer again. Is there a specific track into the VA rehabilitation centers for medical assistive devices that may be supporting the military veteran more than active duty research?
Yeah, hi. With the VA, I think it's, you've been to one VA, you've been to one VA. So if you have questions about working with us in San Antonio, you can reach out to me. Alicia.swan@va.gov. It's such a hard email address. And then I can help connect you with things, but there's a bunch of layers to that too, because here in San Antonio, we're one of the 5 polytrauma rehabilitation centers. Oh, thank you. So we're kind of a unique, different aspect of the VA rehabilitation system, if you will. But I can help connect you with anybody probably in that space in particular, since I do rehab research. So, I don't know if that.
One more question?
So with the sort of, growing focus on telehealth, remote monitoring and things, what's the best way to go about sort of designing and developing things so that they can work within, either just hospital DoD networks or, potentially more operational medicine environments? Are there specific groups that we can work with to make sure that we're compliant and working with or getting access to those certain networks?
You actually took the first step because you're here in Velocity, you're local, and you just saw the office hours for Institute of Surgical Research. So Dr. Jose Salinas' group from the AISR has office hours on Friday, and they're doing everything that you just spoke on. So AI, machine learning, human machine interface, virtual health, all of that. And we are just one of many efforts throughout the whole DoD community that's engaged in this space. So, we keep plugging away at it, with the first contact point here, and then you will open up a lot more opportunities with other researchers and collaborators with your similar line of work.
So is that sort of the recommendation is sort of go through the DoD collaborators and then they can make the connections to get access to the networks as opposed to trying to find a specific office that handles that?
Having done this a few times, the observation here is you can go, predominantly two routes. One of these large summits, if you don't have a pinpoint PI in mind, such as MHSRS, and we have AIM coming regionally next month. Or you can focus your efforts, and if you know the idea that you have, the innovation that you want to pursue, and then kind of in the same area of research that a particular PI or group is leaning towards or actively conducting right now, that's where you would start. And then they would go ahead and focus you in.
Chris, what's that conference for medical on IMIT? It's really an issue.
HIMSS.
HIMSS, thank you.
So if you didn't hear that, it was HIMSS.
No, HIMSS.
Love to hear it.
Okay, so excellent conversation. Thank you all for being here today. We are at the end of our hour, but if you would like to have further conversations with anybody else in this room, particularly our panelists, you can drop me an email at Patty, that's PATTI, @velocitytx.org, and we will get you connected. So thank you for coming today, and we look forward to seeing you in June at the AIM conference.
Thank you.